to you. I'm Madalsa Ramjutun, and I will give a glimpse about my life with Kiran, my autistic son. Kiran was born on 14th of July 1991 in Wigan, in Village Hospital at Wigan, that's in Lancashire. During his infancy, as a baby and as a toddler, his physical and mental development seems to be normal. However, at the age of 5, when he started his reception class, and then his teacher, who was an SEN teacher, special education needs teacher, noticed that there's something wrong with Kiran. His speech was not, he was not talking normally. We are advised to take him to a specialist to have his condition assessed. It was then that he was diagnosed as an Asperger's syndrome, which is a mild form of autism. However, when he was 10 years old, he was further diagnosed as autistic. Growing up within the family environment, Kiran gets on very well with his family, both in England and in Mauritius, where I originate from. Looking and caring after Kiran can be at times very, very challenging. He has phobias about loud noise, which can trigger his challenging behavior. Most of the time, Kiran is a pleasure to be with, and he's a very loving and sensitive boy, and he's loving and sensitive to other people's needs, and he's a good helper when he needs help, anybody needs help, he's here to help. After his diagnosis, Kiran attended mini school, special needs school. No matter where he is, this becomes very difficult for me to control. And over the years, it has affected my health so much. I started taking antidepressant tablets to be able to cope with. It has caused me a lot of stress, and sometimes I did feel suicidal. I'm sorry to say, but I did. I was on my own to bring him up. He's so happy to have his brother also as his second carer. I am his main one. He becomes very, very agitated and confused, wherever he is, if anything happens outside his routine, he's really, really get upset and very disturbed, and this really creates lots of stress for us all, for me, and he becomes aggressive as well. It does require tremendous understanding on our behalf to keep Kiran happy, understanding, and we have to be compassionate, and we have to, he needs love. Most of these people needs love. There is also the danger of busy roads and meeting strangers, as Kiran has no understanding at all, and he needs to be constantly supervised. As he was growing up, his autism became more pronounced. For example, he used to banging his head on the walls, trying to cut himself and harm himself, throwing plates and glasses on the wall. He's very dependent and can never be left on his own whatsoever. We now have a fairly stable life, but I would appreciate any further help, I could get. I would say autism in itself is not a mental health problem. It is a disease in itself, and due to a lack of support, help, awareness, and understanding, it affects them mentally, and it is labeled as mental health problem. According to a report published this year, 1/3 of autistic adults have developed severe mental health problem due to a lack of, as I mentioned earlier, understanding, help, and compassion, everything. Because of this, it has led Kiran also to shut himself away from, people, because they tend to stare, they tend to judge, and they tend even to abuse. I have gone through that experience myself. Um, the least and the loss, I would say, thanks to ALCC, my life has changed for better and I don't feel isolated and lonely. It has given me the opportunity to meet people and socialize. Through ALCC, I started to join yoga class and do the activities that keeps me going and happy. The people are just great and they do so much. They work so hard to give you a better life and a happier life. God bless them all. Thank you so much.